Today we are diving into Rhesus incompatibility, and Rhesus grouping was discovered by Landsteiner in 1940, where they found that some individuals, their red cells, or what we can call RBCs, some individuals had antigens called Rhesus D on their surface. So you find some individuals had the antigens on the surface of the red cells, whereas others lacked this antigen. And this antigen was named antigen D. So individuals with these antigens, they are known as Rhesus positive, whereas individuals which lack the antigen, those who lack the antigen D on the surface of their red blood cells, they are known as Rhesus negative. So here we have a couple whereby the father, or what we can call the man, is Rhesus positive. So the man is Rhesus D positive. Why? Because he's having antigen D on the surface of the red cells. Whereas the mother or the lady is Rhesus negative. Why Rhesus negative? Because on the surface of her red cells, she's lacking antigen D, thus known as Rhesus negative. So when these two marry, when they get married, we are going to find when this father who is Rhesus positive gets married to this lady who is Rhesus negative, the Rhesus positive and Rhesus negative mother, the child or the fetus will end up either being either positive or negative. So if it happens and we find the fetus she's bearing in her mother's womb becomes Rhesus positive, whereby the fetus's RBCs have antigen D on the surface of the red cells, remember the one of the mother is negative. There is no antigens. So the mother's immune system is going to recognize this antigen D on the surface of the red cells of the first pregnancy as foreign. So what will happen when and this one is recognized, or the cells of the mother, they recognize this foreign antigen either when there is trauma during pregnancy, or when there is placenta abruption, or during delivery, or during birth, when she's giving birth. So these two situations can make the blood of the fetus mix with the one of the mother, either when there is trauma and blood leaks, or placenta gets a problem, or during delivery, the blood of the fetus can mix with the one of the mother. And hence, her red blood cells, which were lacking this antigen D, they become also sensitized with antigen D. And when they get sensitized, they manufacture what we call anti-D antibodies are formed. So these anti-D antibodies, they are formed in smaller quantities during the first time, and they are majorly of IgM type. So these ones cannot cross the placenta. So the first pregnancy is not affected. So the first baby will be given to when is normal. But the subsequent pregnancies, due to the sensitization of Rhesus negative mother with the blood of the fetus which was Rhesus positive, this one causes sensitization, and on the second pregnancy, in case this same mother gets pregnant with the fetus who is Rhesus positive, these antibodies which were manufactured in the first pregnancy are going to be released in high concentration. So we shall find And these ones, because it's a secondary response, they are going to be of IgG type. That is immunoglobulin or antibodies IgG. And these ones have the ability to cross the placenta of the mother. We are looking at the second pregnancy, either the third or the fourth. So the following ones, we shall see production of antibodies of IgG type, which are small in size and can cross the placenta. So during the second, the third, the fourth pregnancy, we are going to see these antibodies entering into the fetus, and they start destroying the fetus red blood cells. And if it is intense, even the fetus dies in the mother's womb. So the second pregnancy, we are saying the child is going to suffer from, is going to get signs like anemia, since the red blood cells are being destroyed. And because the rate is high, it is going to get jaundice. Jaundice is yellowing, whereby you find someone's eyes are yellow. And this is due to increased bilirubin levels, which results from destruction of red cells. And if it is severe, it can result into hydrops fetalis. Hydrops fetalis is whereby there is fluid accumulation in the fetus, leading to swelling. The baby will swell, and this one, if it is severe, it can result into fetal death. Fetal death. But sometimes they are born and they suffer from this. The corrective thing of this condition is known as hemolytic disease of the newborn. So whereby these babies are born with severe jaundice, with severe anemia, and their red cells are being destroyed. Sometimes due to fluid accumulation, they even get high increased heart rate is also there. So this is what will happen to the second, to the third, or the pregnancies which will occur when a Rhesus positive man marries a Rhesus negative mother. But this one is solved by doing antenatal. That's why we normally encourage during antenatal to do what we call blood group, both ABO and Rhesus. So when the doctors discover that a man is positive, a woman is negative, there is a preventive method. It does not mean your marriage should stop. Rather, be in touch with your doctor to see how we can prevent these subsequent pregnancies from getting a problem. Because this one can result into the fetus dying in the mother's womb, and the majority when they are born, few survives. And those who survive, because accumulation of this bilirubin, which is unconjugated, crosses the brain and can lead to a baby failing to hear, a baby having seizures, having convulsions, and even lacking the senses. So it is very dangerous. But once discovered during antenatal, the mother will prevent it by giving Logam. Logam, this is an anti-D antibody. It contains anti-D antibodies. So this is given to the pregnant mother at 28 weeks when she's pregnant, and also after delivery. After giving birth, it is given within 72 hours to prevent sensitization of her antibodies, so that when another pregnancy comes, there is no circulating anti-D antibodies which can attack the fetus red cells, leading to death. And many children, we have lost them in this way. So that's why you are encouraged, every time you get pregnant, come with your husband and we check for your blood group. Especially when you're negative and your husband is positive, Rhesus, make sure you do antenatal and let your doctor ensure to give you this injection, so that you can prevent this HDN, which is a very dangerous disease, whereby we have seen The fetus can either die still in the mother's womb or even after delivery. Many of them die within the first week. But when we have prevented this, these children will always survive. Thank you for learning with us. Please remember to subscribe, like, and share to many others. May God bless you.